Hello, everybody. It's Monica Helps with your daily Fishers Health Department update. Today is Tuesday, September 29th. Because it's Tuesday, we will do a full review of the metrics. I'll save you the suspense and just let you know that we're going to stay in yellow. So to stay in yellow, we are staying in yellow because our percent positivity rates are in the green to yellow category and our case incidence rate is in the orange category. So that really kind of evens out into keeping us in yellow for now. We continue to see positive trends in the form of trends that we want to see, not more positive people. So that's good news. But from a community transmission level, we still feel that we're at a moderate community transmission, even though the state moved the state to stage 5. We are not out of the woods and we need to continue to be vigilant, and our rates suggest that we're still seeing a moderate amount of community transmission. So no moving to green this week. Sorry, guys. Our percent positivity at our Fishers Health Department testing site is 4.05%. The state is reporting the county rates at 5.6% for individuals tested and 3.6% for all tests done. Our case incidence rate on the 14-day rolling average is 11.71. So on average, we're getting 11 and a half cases a day for the last 2 weeks. So it's not nothing. It's still out there. Secondarily, some of the contextual factors that we consider when we're trying to figure out if we're going up or down or which way we're headed and how well we're doing. So what we look at for that is measures of public health capacity. And what we see on that is no change from last week. Our testing availability remains quite strong. We have a number of appointments available. And you can get a test within 2 days easily at our site, as well as many other sites around the area. So we're putting that in green. Our testing turnaround time is in less than 2 days for our site, as well as most of the other testing sites in the area. So that's staying at green. Our tracing capacity is quite strong. We have quite a lot of contact tracers here. About 8 of them have been hired to do contact tracing, support the schools, do the notifications for people who have been identified as contacts to a case and to support those activities. So we are able to notify people quite quickly. The state's process is a little bit lengthier as it has been, but even that is tightening up a bit. So I'm putting the contact tracing in the green to yellow. So overall public health capacity is in green. Our healthcare capacity remains pretty good. I'm keeping that in green as well. The hospital capacity, we still have plenty of capacity in the hospitals. Hospitalizations are not increasing or decreasing for District 5. Emergency department visits are decreasing. ICU admissions are decreasing and deaths are decreasing. So all of that is good news from a hospitalization and death standpoint. I do want to caution everyone that just because we've moved to stage 5, we are not out of the woods yet. We are still seeing moderate community transmission. That's why we're staying in yellow. Even though the governor has moved us to stage 5, and even though the state's metrics are having us in their blue category, we are actually seeing moderate amounts of community transmission. So we do want to continue to use caution. We feel that the response is quite good. Continue to wear your mask, continue to do your distancing, continue to wash your hands. We can keep everything open. Continue to use caution, continue to keep your social bubbles small, use discretion in the activities that you participate in, as usual, as you've been doing and as we've all been doing for the last 6 months. We don't have to be on total lockdown, but we do kind of all need to be in this together to really make some headway and get through this. So I know that this is all really tiresome and an inconvenience, but we can do this, and we're showing that we can do this and we can do this safely. So thanks for all your support, you guys, and keep up the good work. Again, if you need testing, it's very available. So if you're thinking that you're having symptoms, if you've been in contact with somebody, if you're worried about visiting somebody at high risk, just go get tested. The capacity is there, and it's easy to do. So take care, everybody. We'll see you tomorrow.